All right, folks, good afternoon and welcome to Recovery Live. C4 Innovations is just thrilled to bring you another Recovery Live event. And as always, we will continue to bring top-tier speakers, interesting and challenging issues, and creative strategies that help peers and non-peers alike in improving the lives of others that are experiencing behavioral health challenges. Now, we at C4 Innovations, or C4 for short, are committed to advancing recovery, wellness, and housing stability for people who are marginalized. We are absolutely committed to reducing disparities and achieving equitable outcomes, and we engage and support and partner with service organizations, with communities, and with systems to develop and implement research-based and evidence-based solutions that are always person-centered, recovery-oriented, and trauma-informed. You can learn a lot more about the work C4 does simply by visiting our website at c4innovates.com. And please don't forget to follow us on Twitter, Facebook, LinkedIn, and YouTube if you're so inclined. Now, today's Recovery Live events are, like all of those in the past, interactive. You engage directly with our speakers and each other, through the live chat box. The speakers are going to share some of their initial thoughts and then are going to answer questions that all of you raised during this event. Audience members are in a listen-only mode, and you can introduce yourself and pose questions and share ideas and resource links, or let us know that you've got some tech difficulties simply by typing them into the chat box. And if you'd like to send a private message to the host, please be sure that you've used the drop-down arrow and you select all panelists in order to get your message directly to them. But we want you all to participate in the chat to the extent you really feel comfortable. So to do that, you simply need to make sure that you select hosts and attendees. I believe that's the default setting anyway, and your message is going to go out to everybody in the event. Now, to access chat, just click the word chat on your screen and that chat box is going to pop out. You can resize it, you can drag it to the side, you can maneuver it so that it stays up, but mostly out of the way of the other content. Today's event's going to last about 1 hour, and it is being recorded. The recording link will be shared with every person who registered after the event is concluded. It will also be available on the C4 YouTube channel listed on the slide. Now, if as you are listening to this content, you feel your organization might need technical assistance around this or any other topic, simply email us at training@c4innovates.com. And we'll be happy to discuss the needs and brainstorm any strategies or possible solutions. And then we're going to work together with you to determine the best technical assistance available to meet your individual needs. And in addition to the technical assistance that's available through C4 Innovations, please consider joining us for a variety of other events that are coming in the next few months. Providing peer support in crisis services is going to be a free webinar on August 18th at 2 p.m. Eastern Time. Peer support in crisis services learning community is starting September 22nd. Facilitating post-traumatic growth and recovery will be starting October 7th. And please stay tuned for access to our newest offering, Racial Equity in Recovery, Addressing Race-Related Barriers in Recovery Support Services, as we're going to have beginner and intermediate level courses starting this fall. Now, I mentioned earlier that C4 and Recovery Live events work to bring you top-tier experts and speakers to provide input and expertise on a variety of different topics. Today, we're going to explore how recovery housing supports the recovery journey with 3 individuals who are really on the cutting edge of recovery housing. And I'm pleased to start our discussion today with Erin Helms, who is the Executive Director of the Woodrow Project in Ohio. Erin's going to be followed by Fred Way. Fred is the founder and Executive Director of the Pennsylvania Alliance of Recovery Residences. And then getting us into the home stretch today will be Jason Howell. And Jason is the Executive Director of RecoveryPeople. All right, on to what everybody's here for. And let's get us started with Erin. I'm going to pose an opening question for all of these speakers to respond to. And then I'm going to be following up with any additional questions. I'll be watching for questions that come in the chat for the speakers, etc. So please be sure to add any questions that you have as you're listening along into the chat or the QA box. And then we will be using those questions after the speakers have shared their initial thoughts. Please, if you've got questions, lay them on us. That's what the speakers are here for today. So with that, speakers, here we go. Erin, can you talk about what you feel is the biggest problem facing people in recovery who are also looking for housing after treatment?
Sure. Thank you so much for having me today. Really, for decades, we've recognized that addiction or alcoholism is a disease, which is, spectacular. We've changed language and have made some progress moving away from that acute care model to a chronic care model, which is really necessary. Matter of fact, policymakers have been talking for decades about recovery-oriented systems of care. We talk about ROSC all the time. And we've made some progress towards supporting peer supporters. Where we've really fallen short is the execution around recovery residences or recovery housing. People in recovery deserve to live in quality recovery housing. People, regardless of where they come from or how much money they have, should be able to live in a recovery house that meets basic standards. Recovery residences should be places that, at the very minimum, don't have people using. They should not have to live in overcrowded homes. They should not have to worry if the water or heat is working. Recovery homes need to be clean and safe environments with support for people to make those changes. In early recovery, we all know people are in pretty vulnerable positions and oftentimes are desperate. Because of that desperation, people in early recovery oftentimes take whatever is available. There's sometimes this belief that because somebody, because of their actions and active addiction, that they almost deserve to live in subpar housing. But that's just not the case. That's not going to help anybody. And please don't misunderstand me. I'm not saying that we need to create Taj Mahals or anything like that, but at the very basic, having clean, safe environments without people actively using is an absolute must. And the crazy thing is we have a set of standards and multiple organizations that will help organizations or operators meet those standards. It's really not rocket science. Providing a safe and supportive environment is, it's not that hard, but it does take commitment and it does take work. There's no other disease that I can think of that would allow for somebody to go from an inpatient treatment and then move into a place that, may or may not have people actively using or drinking. Recovering people have basic human rights. And one of those rights is the right to have quality recovery housing. Whether a person comes from Malibu or the streets, they should have the option to live in a place that meets standards and are able to support them in their continued journey through into long-term recovery. And we have lots of evidence that shows that recovery housing and recovery residents really do work. It saves significant amounts of money in comparison to people going back to their own environment. So it's really that basic human right of being able to live in a safe, clean, supportive environment and being able to really get well.
Erin, just beautifully stated. Thank you for kicking us off. That was fantastic. Let me check in with Fred and Jason really quickly. Anything you'd like to just add, dovetail along with what Erin just shared?
No, I think Erin hit it straight on the mark. I mean, we all work in this every day, Stephen, and we all want to see clean, safe, sober housing for everyone. And at the end of the day, that's what we attain to do.
Fantastic.
And the only thing I would emphasize is my hope is that policy starts shifting to where we focus in on that recovery ecosystem. It's great to have more recovery-oriented clinical settings, but we really need to flush out that community-based recovery-oriented system, that recovery service ecosystem.
Jason, let me ask you, can you say a little bit more about that? Just particularly around the services and supports.
Absolutely. So I think that, Erin did a great job talking about, the shift in ROSC. And so that's getting our mindset in the right direction. We just haven't seen follow the money. We haven't seen as much money come to the recovery service ecosystems. I'm talking about recovery housing, which is topical for today, but also recovery high schools, community centers, APGs. We need to flush out this entire local ecosystem, in addition to having access to prevention and clinical systems that have an eye towards recovery. And I understand from our policymakers' perspective that it's steps in the right direction, and I applaud their work thus far. And so now I think it's time for us to really focus in on that. And many of you all may have heard there's a movement towards getting an increase in the substance abuse block grant and a 10% set aside for recovery. That would be amazing. So I put that out to the universe.
Jason, that's fantastic. Thank you for sharing that. Fred, you're gonna add in?
No, I mean, it's about time that they start looking at funding recovery housing. Okay, because without recovery housing, it would be a lot of individuals that would be on the street.
Absolutely. And Fred, thank you for that. To me, it's really just about funding us. Just fund us appropriately. We're not asking for, the moon. Just fund us appropriately, and we'll use that money very judiciously and carefully. We've proven that.
That's what I say to governmental agencies now. We don't need a lot. We just need a little.
Yes.
The only thing I would add, your listeners may be going, okay, what can I do? This sounds really exciting. This is the opportunity. We've got appropriation bills. So contact your congressman, both on the House side and the Senate, and let them know that you want them to support or fund recovery services.
Jason, that's fantastic. And it just reminds me of one of the sort of primary roles those of us with, histories of lived experience have, and particularly those of us in recovery, and that is advocacy. So yeah, hear you loud and clear. And Fred, let me come at you with an opening question.
Okay.
How in the heck do people locate recovery residences when they're looking for them? And particularly, how do we know across the country?
Well, Stephen, I will attempt to answer that question for you. When we're looking at recovery residences or recovery housing, there are two main models. You got the Oxford House model, okay, which is a level 1 model in our world of the National Alliance for Recovery Residences. Okay, it is a self-run, self-supported recovery house for those recovering from a substance use disorder. Oxford House offers a highly structured living environment that helps individuals stay off alcohol and drugs by learning or relearning how to achieve long-term sobriety and responsible civic behavior. Oxford houses are a group, 6 or more recovering individuals of the same gender, must be democratically self-run using the Oxford House 43-year-old Oxford House disciplined system of democratic operations set forth in the Oxford House manual. The group must be financially self-supported. The group must immediately expel any resident that returns using alcohol or illegal drugs. Okay, now the participants that's on this call, you can access Oxford House by going to www.oxfordhouse.org. Okay, and on there you can access their Oxford House resident directory for every state. Will show you where there are Oxford houses. Now, Oxford Houses directory actually have the phone number and address of their houses, which you're able to call if you are trying to make a referral, you would call because there has to be interviews for everyone. Okay. And the housemates have to agree to let you in the house if they feel as though you are ready for that level of care. Next, we have the National Alliance for Recovery Residences and how to access the NAR model, which are certified recovery houses throughout the country. You would go to naronline.org. You would see a map. And on that map, you will see NAR affiliates, which there are right now 35 NAR affiliates throughout the United States. Those NAR affiliates will have a green shade on that state. Then there are affiliates that we are working with, which will be blue, which we call being in formation. Okay, now, when you access that map, you will see contacts in each one of those states. Okay, and you can reach out to that contact either by phone and or by email to find out exactly, where that recovery residence is and how you have to access it. Okay, along with that, every state in the United States has a single state authority. Okay, and that state authority within the state authority has what they would call their behavioral health entity, which would be substance abuse and or mental health. Some are individual and some are combined. They generally can let you know in that particular state where recovery housing is. Some states have more recovery housing than others, but they all should have some form of recovery housing to be able to access, okay, and that level of care that you're looking for. Now, recovery housing comes in many forms and many sizes. Okay, you have the NAR model, which is level 1 through level 4. Okay, which you looking for a very low demand structured recovery residence, then you're looking for a level 2. If you are looking for a more supervised, more structured recovery residence, then you're looking for a level 3. And all that information will be on the NAR website. Okay, and each affiliate that you will call will have a person like myself, okay, that you can call to say, Fred, I have someone, not particularly sure what level of recovery residence they're looking for. We will, by form of talking with that individual, be able to place him in that correct recovery house. Because if you place them in the wrong one, they will not stay.
Fred,
Yes, sir.
thank you. That's a ton of information. And I already saw in the chat somebody asking for, put the website in the text, please. And I also saw that there was a question in here that Jason has responded to in the chat itself. And it said, so Oxford House does not use harm reduction. That, I think that's, they were posing that question. And basically what Jason had responded was Oxford House and other types of recovery housing can accept a person on MAT if that is what you mean by harm reduction. Some approaches to harm reduction do not align with recovery housing. Hope that helps. And I suspect we'll have a larger conversation about this as well.
Yes, because medicated assisted treatment and or medicated assisted recovery, is very, very popular right now. And just a quick note, if you are in a state and you are a recovery residence that is probably being funded by that particular state or agency, you generally will have to take individuals on MAT. If you are an individual recovery residence that's operating independently, then it's your choice to take whether or not you want to take someone on MAT.
Fantastic.
And like I said, we will probably talk about this further along as we go.
Yeah, absolutely. And Fred, thank you for that. Let me turn to Jason. Jason, do we even know how many recovery homes exist in this country? And with that, how do you use that information to drive policy?
Yeah, great question. Yeah, we need good data to drive good policy, right? And believe it or not, there's not been a comprehensive census of recovery housing until recently. And I'm really excited to be a consultant on a study. It's the National Study of Treatment and Addiction Recovery, or NSTAR for short. It is the first nationwide look at recovery housing, of all types of recovery housing across all states. It's funded by NIAAA, which is the National Institute of Alcohol Abuse and Alcoholism. The principal investigator is Dr. Amy Miracle. She's with the Alcohol Research Group, which is part of the Public Health Institute. And she's put together this really great team of researchers and subject matter experts that are doing a deep dive and kind of like asking those questions. What's the availability? Where are they? To what extent are they using evidence-based programs and practices? What are the characteristics of the home? What type of recovery home? You heard Fred talking about the different types. And so, what does that look like? And something that's really timely is, so how did the pandemic impact recovery housing? And so this is really important information that we need to drive, good policy. So where is this study? Where are we in the timeline? There has been a database of recovery homes that has been established, and that was no easy feat. Trying to find out, how many there are. And there's a lot of people that say they're recovery housing, but they're really not. And so kind of, weeding through all that. That's been has empowered the researchers to do some really cool kind of geolocation, so where are they? Rural, urban areas, clustered, spread out, is it matching the need of the local community? That has been presented to the subject matter experts, who in turn gave feedback, and all that is being pulled together. And eventually there's going to be this final report that's published. And so I'm sure your listeners are like, come on, Jason, give us the details. We want to see those maps. What I can tell you now is, if you go to the NSTAR, I wrote it down. So there's an NSTAR website you can go to, which is nstar.arg.org. They also have social media you could follow. Twitter, the handle is /ARG_NSTAR. And then they've got a Facebook page, which is just NSTAR study. And I'm sure that y'all are going to circulate some of these links as resources afterwards. What else do I want to say about it? If you are operating a recovery home, because that's the biggest study, then they're going to do a more intensive survey of 800 recovery homes across the United States. And so if you got an email to be one of those lucky 800, we really need you to fill out the survey. Yes, it's long, because we need that data, because you'll be representing the entire industry. And together we will have a snapshot that can drive the policy that we need. Earlier I was championing, we need dollars to come to recovery support services, and we can't come up with that equation or that ask unless we know what's out there and what we need.
That's incredible, Jason. I mean, that's really incredible. The work that you're doing is, not only is it going to be beneficial for funding for providers, and for folks who are interested in just generally recovery housing, but I cannot imagine how many people ultimately will be served by this. And you brought up one thing that you just mentioned it, and that was around the pandemic. Mm-hmm. And I know that we had a lot of released, a lot of folks got out of jail, a lot of folks got out of prison. I think, there may have been some releases from state hospitals. And I cannot imagine that did not impact access to some of the recovery housing. I don't know where folks might have gone if there was nothing else available. And so it just occurred to me that with these sudden influxes of folks who need recovery, it just tells us the critical importance and need of recovery housing and enough of it to actually meet the demand. So
No, actually good recovery housing, Steve. Okay.
Touche.
Let's be clear. Okay. I mean, we can get recovery housing, but we need good, stable, sober recovery housing.
Understood, Fred. I mean,
And
that's a point.
And to Fred's
an
point, I mean,
important
that's why I've been so, honored to work with Fred, Erin, and many of the other folks that are with the National Alliance for Recovery Residences, because how we've got to have quality standards. We have to have a process of certifying recovery homes that are meeting those standards, because how else can individuals and family members discern, what's a good one, what's a not good one, what's going to be the best for my just because they have a shiny website doesn't mean that they're using best practices. And so we do need to implement that. So you were talking about individuals coming out of institutions, and especially during COVID. So this is anecdotal. We don't have the data yet, but what we saw is that as residential treatment programs started having to implement COVID protocols, it decreased the number of persons that they could serve. And so where were those individuals going? And many were going into recovery housing because it was still using housing rules, and individuals were needing to go somewhere sober, safe, peer supportive, and protected. And then that could open them up to also participating in outpatient if they couldn't get into residential. So I really look forward to kind of the results of the study that has this COVID lens as well, that can kind of help us understand, what just happened.
Awesome. So let me just check in with Erin really quickly, because Erin, I have watched you listen intently, and I know the work you do. What are you thinking right now?
Well, something that Jason had just said about COVID and the work recovery housing operators really got to step up and show how supportive the environments are. So most recovery houses did not see increases in relapses, whereas the rest of the recovery field kind of saw those increases because so many meetings shut down, so much of their support shut down. Whereas in recovery houses, that support is built in. They were able to have meetings together and to really come together as a family and kind of hunker down in those first few months. So we didn't see any increases in relapses. Matter of fact, a lot of recovery houses in those first few months, because people were at home so much and they were able to get that support, we actually saw some decrease in relapses, which is huge. So that I think that recovery housing over this past year really came out as a shining example of this works, and this works in a pandemic that we've never seen before. So the evidence is there. We've shown that it saves money. I mean, across the board, it's there. And even places that people pay to go to, meeting those quality standards is so vital, because just because as earlier they said, just because somebody has a nice shiny website doesn't mean they're going to have a nice place, and you could pay quite a bit of money for that nice shiny website. So those quality standards are paramount, and we need more. I mean, that there's just not enough. When we opened our first recovery home in 2014, 6 days after our first after we opened, we went on a wait list, and we have never gone off a wait list. I mean, that's 7 years ago. So those are the type of numbers that we're looking at. And again, that's just one organization, but that's across many other organizations as well.
Yes, Steve,
So-
and many operators have to be. We have to give them their kudos during COVID, because they had to pivot very quickly. Okay, and when you're in an environment that people can't leave, okay, for days, and be able to handle that, okay, it was difficult initially, and then you went through the phase of when many residents got this stimulus money, okay, and many of them got checks in the amount of many dollars, and they still tried to hang in there. Okay. I mean, this was a test, and I think the recovery residents passed. I would say.
I didn't think about that at all, that influx of cash in a horrifically stressful time, jammed up with, folks that you can't escape from 24/7. It's a lot. It was a lot for folks just at home trying to cope with, the wife or husband back home or the partner back home and all the kids here. I just didn't think about that. And that's such an important point. And that not only did they have an influx of cash, but they didn't return to use and were able to continue strengthening their recovery. Of all the things I've heard, that alone says to me, just tells me the value of a recovery residence, period. That alone is super powerful. Because it is at the very worst time that you could possibly ask people to remain in recovery, right? So, wow. All right, it just was a kind of an eye-opening realization there. So I appreciate that.
I wanted to give NAR props because as we all went through it, as COVID was unfolding, and what do you do? The National Alliance for Recovery Residences, or NAR, was holding, these virtual learning communities of practice, and we're, bringing in the experts and kind of working together as a community to figure out, so what are the right protocols? And, to Erin's point, the providers that are part of this network were figuring it out and being able to keep residents in, even improving, recovery outcomes. And then, we've heard of the other providers that aren't using those best practices and, kicking people out who had COVID and because of COVID, and with some really devastating results. And so, I just want, all of us to advocate for the need of bringing good recovery housing providers together and learning from each other. And even in these moments of crisis, we as a nation of recovery housing providers can adapt very quickly. We just need the help to develop out that infrastructure.
Understood, Jason.
Yes.
Thank you. And that does take me to Fred. Just Fred, in your, the first thing you said when I said, we need more recovery housing, it wasn't, we don't need more recovery housing, we need more good recovery housing. And I think that is the point that Jason just made here, and Erin both, drives that home, right? That quality recovery residences have resulted in reductions in return to use at a time when you would absolutely expect that to increase. So Fred, I didn't mean to interrupt you, please.
Oh, no, you're absolutely right. But also, I think the onset of certification for recovery housing also is key here, okay? Because you have discharge planners, you have parents, that are finding out about this mode, asking, when they call a recovery residence, are you certified? Okay, because they are noticing that's a difference between the Johnny's house on the block and the recovery house that is certified. Okay, because it's operating with standards. Okay, their property has been reviewed. Okay, and they're getting fed correctly. Okay, they're sleeping in a house where individuals aren't over top one another. Okay, it is a difference, and I think we are making the way now to where the country is seeing that this effort is continuing, and it won't stop at this point. We actually call it the movement, and it's been moving for the last 11 years. Okay, and NAR has been instrumental in this movement.
Absolutely. All right, I know we've talked a little bit about this. I've got, actually, I think the next two questions that are kind of on my radar, we have talked about a little bit. We've touched peripherally, but can you talk about the role recovery housing plays for people who are reentering the community from jails, prisons, state hospitals, with COVID outside that picture? I think it may be that the impact of COVID has added knowledge and information to, how does recovery housing play that role for reentry? Can you guys talk a little bit about that?
Go ahead, Jason.
It's our people. When they're because substance use disorder has been criminalized, many people who are incarcerated and many people who are returning from institutions have a substance use disorder and they want recovery. So it is common for them to be, choosing to move into recovery housing, recovery homes, work with diversion courts to help people. So are there barriers? Sure. I think I saw a question in the Q&A about, is there recovery housing for persons who are required to register for a sex offense? And there are a few that specialize in that population. There's not enough. We need more. So there can be barriers based on certain types of felonies, but by and large, it's our people.
Yes, yeah, I can say that, Stephen. Here in Philadelphia, we have specific recovery housing for the individuals returning. What we have seen over the years is mixing the returning citizens in a house with individuals who are trying to work their natural recovery program. It tends to have difficult consequences because everyone isn't there for the same reason. Okay. We also have individuals that have the ankle monitor. Okay. And they take more work to get them grounded into their recovery in a recovery house than the normal individual entering recovery house. Okay. And that's why it's more specific, targeted here than in most places.
That's Erin, go ahead. I'm sorry, I didn't mean to.
I was also going to say, there's two groups of people. There are people who have addictions or have a substance use disorder who have committed crime because of, trying to feed their addiction or possession charges, those types of things. Then there's also those who have, those who have a substance use disorder who have committed a crime. Then there's those who are committing crimes and really have more of a criminal thinking, and there may be drugs or alcohol involved in it. And there are programs for both, and that needs to be going to the right place. So some that work specifically with behavior modification and really being able to support somebody versus somebody that has more of a substance use disorder who, they just keep racking up possession charges over and over again and have entered the criminal justice system that way. So, and again, that's the reason of having more education, more discussion, and really being able to help, because we're seeing this rise in drug courts, and that's fantastic and that's helpful, but we've got to make sure that people are going to the right place.
Really well stated, honestly, all three of you. And I do a lot of training and a lot of work in reentry, and the value of peers who do reentry work, understanding what the recovery housing challenges are for our returning citizens, and then being able to, specify or designate specific housing, because as Fred, commented, mixing folks coming out with folks in the middle of natural recovery has all kinds of potential challenges, and certainly you've seen them and experienced them. So it just makes a lot. I mean, it goes to me the issue of not just cultural competency, but cultural proficiency. And if you're going to give people the best, sort of grounding for their recovery journey, then that cultural proficiency piece, along with your own cultural humility, I think it's just critical. Again, go ahead, Fred. Go ahead.
And I think, the listeners should know, to seek out if you have a NAR affiliate in your state, because that affiliate will be able to tell you exactly which recovery residence that individual may be best suited for. Okay.
That, I hope every peer who does reentry work just heard that, because that's really important for those folks to know. Absolutely. Fred, thank you. I have a question that came in the chat. Jason, I suspect you saw this, but let me just share it with all three of you. I'm a person in long-term recovery and I'm also blind. It is rumored most recovery houses do not accept people disabled receiving Social Security benefits. Is that true?
Yeah, I responded and said that I'd never heard of a recovery home rejecting someone solely based on being on Social Security benefits. Trying to think through that a little bit more. Many recovery homes do require individuals to be engaged in meaningful daily activities. That's one of the recovery supported domains defined by SAMHSA. Employment is only one of those ways to have purpose. Volunteering, care. There's just a lot of other things. They would likely want to see the individual be engaged somehow. I think that the other element, and that's what Melissa was trying to tease out, is since we are talking about employment that's closely tied with income, and the individual has to be able to afford living in the recovery home. So they may be asking questions about, so what is the funding resources or funding stability? And if that monthly amount is not allowing them to live in the recovery home, then that could be a reason. It's not due to the type of funding. Could be because the amount of revenue and the cost of the recovery home are not a match.
Got it. Erin, Fred, anything to add about that?
It sounds like if that was that's a self-pay recovery home, okay, versus a funded recovery home. So if that individual was going or being referred to a funded house, he or she would not have to use the SSI.
How does a person know whether or not it's funded or self-pay? How would you find that out?
You would have to ask the operator, okay, when you're making those calls. Matter of fact, there's a list of questions that whenever you're trying to place someone in a recovery residence, you should have. Okay, I think one of my resources that I sent in was the Consumer Guide to Sober Housing. And it's an excellent guide for individuals if they're looking for a recovery house, what to ask, what type of house it is. Okay, the questions, it's exactly one of the better guides I have seen.
Fred, thank you. We're going to make sure, just for everybody listening, if you've registered for this event, whether you have attended today or not, you'll end up with those resources. They'll be sent out as along with the actual link to the recording. So everybody's going to get that. And along these lines, somebody also asked, what happens when a person is a good candidate but just doesn't have any funding? And I think, right, so and that really connects me to sort of the challenge in rural recovery housing, because it's not like, I suspect there's not a lot of players in the one stoplight town, right? So what happens? How is there a way that if Bob shows up at a self-pay and says, I don't have any money, how could we, is there a way that we can get him to a funded recovery house?
I'd like to step in and talk about that for a second,
Sure.
And I have to give a shout out to Ohio. Our state agency director, Lori Chris, has done a spectacular job really with supporting recovery housing and being able to support quality recovery housing, but also the funding piece with it. So the state opioid response dollars have been used by a whole lot of folks to be able to get in and stay long-term in recovery housing. So, 3 to 6 months of being able to have their housing paid for and whatnot. And the state agency did a really spectacular job of making sure that urban areas as well as rural areas were able to make sure that those that was part of where the funds went. Additionally, the state of Ohio, I think about 5 years ago, required that every county board planned for recovery housing, which is really something that's unheard of in a lot of other areas. So in Ohio, because of having that leadership at the top, it's made a big difference in those rural areas as well.
Erin, thank you for really just highlighting how important it is to have a champion somewhere, outside of you. Because look at what it's done for Ohio, right?
Absolutely.
Just really important, and I think, those of us who are in recovery understand the value of champions. There's no doubt about that. So,
and how did that happen in Ohio? Because we can all like, go Ohio. And like, how did that happen? And I know it's because there's a lot of great advocates among the Ohio recovery housing community. I was in DC and heard Senator Portman just start talking about when he visited some recovery homes in Ohio, and was like, what? A congressman coming and knowing house managers. And so that's the level of advocacy, that I encourage everybody to do. I mean, we talked about, there's some opportunities right now with the Substance Use Block Grant for people to let, their congressmen know, not only do we need that money, but that money needs to be available for recovery housing so that we can get someone connected when they're ready and they want it. There's money coming through HUD, through the Support Act. There was recovery housing dollars that is coming through that agency. 21 states were eligible for that funding, and they're kind of putting together how they're going to spend that money. And so there is, at the state level, there is somebody that's deciding how to spend those recovery housing dollars. And I would encourage your listeners to reach out to their state agencies and find out who's making that decision, and make sure that those dollars come into housing vouchers or some kind of mechanism so that we can get people who want and need recovery housing connected with quality recovery housing.
Fantastic, Jason. Really well stated too, my friend. Thank you. So there's a question that just came in the chat, and it just caught my eye because this person says, what other states are committed to using state opioid response dollars to help individuals get into recovery housing? I'm in Louisiana, and I have never heard about this. I work under the SAMHSA Dated Action Grant working on opioid prevention. Thoughts, comments?
I know Michigan has as well. I know that there were some other states out there that used it to kind of start at the beginning with supporting their state affiliate. I know Michigan did. I'm sure that information can be found someplace, but I don't know exactly all the states that did. But I do know like I said, some of them are starting with that state affiliate and really getting that piece of it going, which is a good place to start.
I know that several states were using their opiate dollars, the SOAR dollars, and looking at doing some of that stuff. I know there is the Opiate Response Network. It's a TA. So right. What was popping in my head is that sounds like a TA request to me.
Yeah, me too, Jason.
Of reaching out and saying, help us find, what states are leveraging those federal dollars and how they're using it. Because then that way you could go to your state agencies in Louisiana and say, have I got an idea for you?
That's fantastic. I am a recovery consultant for the Opioid Response Network, and I recognize, that's where my head went instantly. Oh my gosh, what a perfect TA request, right? So yes, if you're listening and you are interested, just access your ORN, your Opioid Response Network individual, and you can do that simply by going to www.orn.org. And it'll take you right to their website. Fred, you were going to say something?
Oh, no, I see the question. She's asking, what is TA? And it's technical assistance.
Fantastic. Thank you.
I would also just like to mention real quick, there's also try and think creatively. So we know that insurance doesn't pay for housing, and that's something that, has been longstanding for quite some time. Back, 7 years ago, there were those cures dollars that would pay for peer support. So if your recovery housing organization provides peer support as part of some of the work that you do with supporting the residents living in the house, that was a grant that we had qualified for way back when. And yeah, it's not going to pay for everything, but being able to piece those things together is really being able to come up with a good, solid foundation. So being able to think a little bit outside the box. And once, at least from what we've experienced, is once you start getting in there, then you can, it seems like there's more opportunities that exist.
Fantastic. Erin, thank you. Fred, Jason, Erin, that conversation is just so important. I'm going to toss out I think probably the last question for today. And it's one that, we again, peripherally touched on, but as soon as I start talking about it, I think, we'll all know that, the tension around this. So the current opioid epidemic has highlighted and really expanded the evidence-based approach of medication-assisted treatment. That, in fact, that's the goal of the Opioid Response Network, expand access to MAT. Given that the premise of recovery housing is really a safe, secure home that promotes abstinence from illegal drugs and alcohol, can you all talk about what this has meant for recovery housing providers, for their residents, for those individuals who are seeking housing, who are also using MAT as a component of their treatment and recovery supports?
I'll jump in because I think that, there's been a lot of work around this area. Historically, recovery housing, it's been around since the mid 1800s and has symbiotically been connected with mutual aid societies, whether it be the Washingtonians or Alcoholics Anonymous. And so those are the communities that help, inform and support recovery housing. And then you look at medication assisted treatment, and that's come through more of the medical model. Some people see more harm reduction. So those two worlds have historically not played together. And so here we have this historic moment where we can bring the two worlds together. And there's a lot of learning of how do you do that in a way that supports and understands one another. And there's a number of efforts to look at that kind of a Venn diagram. And in that center is where the term medication assisted recovery came from. People that are using MAT and as a way of pursuing recovery. And there's, just last night, I was facilitating a group. It's a learning collaborative of recovery housing providers, looking at how do we do that and how do we do it well. Erin's actually one of our faculty members on that. So there's a lot of efforts going into figuring out, how do we do this, and I see it moving in the right direction.
So do I. I have seen the stigma of MAT decrease over the last year. And I've seen education around MAT increase over the last year. And I've seen operators become much more willing to hear about MAT, and those operators who was resistant to MAT now are much more willing to accept it. And I think that would only continue to go. Okay. Because around this area, education is everything. If you can't educate everyone, then they'll never know. Okay. When you have community meetings, okay, if you do not educate them on what exactly a recovery residence is, they'll never know. Because they come in with a certain idea about a recovery house. Okay. And those individuals who live there. And no, you have to explain exactly what they are. Okay. And what, again, a good recovery house, how it operates.
Yeah, I would just add on what they're saying is it's possible, and it's not all that difficult to do, but it does take some time, and there's a proper way to do it. So being able to provide support and education and training, what Jason has created down in Texas of really being able to walk operators through this process to do it well. And that's, I think, the kind of message through this entire, the past hour has been doing recovery housing well and how to operate recovery residents that can meet the needs of the individuals. And we see people that are on MAT as just as abstinent as those who are not, because they're taking their prescriptions as prescribed, and it's their recovery that's working for them. I think the other part is operators working within the recovery field. So working with the provider, and we see them 95% of the week they're in treatment, 12 hours a week. We see them the rest of the time. So making sure they're on the right dose, and really having those treatment providers recognize the role that housing operators play in the lives of their patients.
Really well stated, Erin. And all three of you, honestly, I could just listen, particularly around this topic. And I don't think it's a secret to any of you that, I've been using MAT, really MAR, now for 20 years. And I know that, as Fred was saying, he's seen this increase in acceptance. It's, the increase in education, and then the subsequent decrease in the stigma that's related to MAT. And I certainly have been, pushing myself. It's one of the reasons that I talk about my own MAT and MAR use, because I'm normalizing that. There's lots of us who are, in recovery as a direct result of the medication support. But I think it's really important to clarify something, because a lot of folks think that MAT is the recovery, and it's not. MAT is the medication, it's the treatment. Recovery is what you do after you get the treatment. And I share all the time, if you go to the hospital with you broke your femur, the biggest bone in your body, when you get there, the doctor puts a traction splint on you and treats you. Your recovery comes when physical therapists show up, get you out of bed and say, here's what you need to do. So I can really see, in fact, it's giving me the chills, because for me, had I had access to recovery housing in my early recovery, those first couple of years, I may have been more focused on recovery instead of just symptom reduction, because my goal at that time was really to just remain well. And had I had access to a good recovery residents and people who were, frankly, honestly, working the steps, whether they were using an MAT version or they were using, traditional 12-step approaches, that would have been incredibly helpful. And I have worked the steps over 21 years. I just could have probably done them a lot faster. So all of these pieces around recovery housing, all building to really provide the support in a holistic way for really the full recovery journey. And it's an amazing piece of work that all three of you are doing. And I'm not sure that people recognize the challenge and the difficulties and the lack of money that you've all had to deal with over the years. So kudos to all of you for just hanging in there and continually pushing forward, even at times when it doesn't feel very very friendly towards recovery for us out there, So listen, we are at the end of our time. I honest to God could spend the whole day just yakking with you guys about this, because it's such an important topic. And as I said, I have my own sort of personal bias in a good way towards making sure that my brothers and sisters on MAT get the same benefits that everybody else does. So again, I want to just thank Erin, Fred, and Jason. Just an awesome discussion. And we hope you'll all join us for our August Recovery Live. We're going to be discussing engaging adolescents in early recovery. That's going to occur on August 26th, 2 p.m. Eastern. And before you run off to the rest of your workday, please be aware a link to a satisfaction survey is going to pop up when we close this online waiting room. It takes you less than 3 minutes to complete it. Please give us the feedback. Your comments and suggestions are important. It's why you have Recovery Live. We listen to you, and what you are seeing are because of the suggestions of those who've come before you. So if you have any additional questions or thoughts, put them in the satisfaction survey. And don't forget, we're here to provide training and technical assistance at any time. You can access us and just talk to us about it at training@c4innovates.com. And if you sign up for C4's newsletter, you'll get the training updates too. And you can just email media@c4innovates.com to get on that list. Thank you all for joining us for today's session. Thanks again to some awesome speakers, and I hope you all have a great afternoon. Thank you.